One of the most common questions I get in the office is once someone starts chiropractic care, how long do they have to come to keep their spine healthy? And that's a great question because it really comes down to understanding the difference between pain or relief care, corrective care, and protecting your progress through maintenance care. Hi, I'm Dr. Adam Mead, and what I want to talk to you about today is maintenance chiropractic care, how it protects the progress you've made and really promotes long-term spinal health. Here's something really important to remember though. Many of you felt better during relief and even corrective care, but feeling isn't the same as being fully healed. When you first came in, our focus was helping you with things like reducing pain, improving mobility and flexibility. That's relief care, getting you back to doing life without pain. We then moved into corrective care, which the main goals were really correcting the underlying structural problems, retraining your spine and posture, and getting your nervous system working properly. Finally, our focus is maintenance care, keeping the progress you've made. Just like brushing your teeth, eating healthy, and exercise, maintenance helps prevent these problems from returning. But one of the key things to also understand is even when you finish your corrective care plan, there's something important to remember: scar tissue and adhesions. The scar tissue and adhesions that have formed along the muscles and ligaments of your spine, they can take anywhere from 12 to 18 months to really fully remodel and heal. During that time, your spine is still vulnerable to falling apart. That's why consistent adjustments, even when you're out of pain, are essential to protect your results overall. Corrective care aligns your spine, restores its function, and really reduces the nerve irritation, but the deeper healing process is continued long after the pain is gone. So here's a question to think about. Overall, when it comes to your health, if you stop taking care of your spine right now, how quickly do you think you'd start to see a loss of your progress? The truth is, you could start losing progress in just a few weeks or even after the first month. Joints begin to stiffen, muscles tighten up, and that scar tissue builds back into the muscles and ligaments. That's why maintenance care is so important. It's very similar to exercise and fitness. Many individuals, once they've taken 2 weeks to a month off of their routines, they can lose upwards to 15% to 20% of their strength and flexibility, just like that. Some people say, I'll come in when I feel like I need it. The problem with that is that pain is the last symptom to show up, and it's many times the first one to go away. So waiting till you feel pain again means you're already moving backwards, you're breaking down, whether that's over weeks or months. And that's like, really, in a ridiculous way, only brushing your teeth when they hurt. It doesn't work. So what are the true benefits of maintenance care? Well, the maintenance care of chiropractic adjustments keeps the spine moving and keeps pressure off your nerves, but it really prevents that scar tissue from building up and gluing those joints, locking them back up again. It reduces the reoccurrence of old injuries, and it helps avoid the flare-ups of pain, sciatica, neck tension, and joint discomfort. It also supports your nervous system, which runs the show, which means better energy, better focus, and overall better health. So how long do you have to come? Well, here's the real answer. You don't have to do anything. But if your goal is not just to feel better, but it's to stay better, chiropractic care should become a part of your lifestyle. Most of our patients in the office choose maintenance adjustments, and these adjustments are usually once a week, maybe every other week, because they want to protect their progress, prevent relapse, and really keep living at their best. Remember, health is an ongoing process, just like exercise or nutrition, or even dental care. Chiropractic care is most effective when it's consistent. So the real question isn't really how long do I have to come, but rather how long do I want to stay healthy? I'm Dr. Adam Mead, and I hope to help you keep your spine healthy for years to come.